Thank you all for coming, and again, congratulations, both on your babies and for coming tonight, because you passed your first test, right? Because you're figuring out how to help take care of these kids you're going to have before they're even here. So congratulations on that too. This is really important that you know as much as you can about this baby that's coming. So that's what we're going to talk about tonight. And we're kind of going to go through what happens in the hospital, what happens in those first few hours, first few days, how to get ready for that. And then we'll talk a little bit about what happens after you get home and kind of in that first year of life, some of those common questions that come up. So we'll go ahead and get started. So this is actually a picture of my first son, Elliot, when he was 2 days old, obviously, because he was born on the 6th. So, and that picture says the 8th, so that was when we were still in the hospital. So, and that was back when my husband and I were both pretty panicked at that point, thinking about going home and what we were going to do with this little guy. So what do you need to do to get ready before you get to the hospital? You need to pack your bags. So a lot of things will say have it packed 4 weeks ahead of time. Well, obviously, you probably can't have everything packed 4 weeks ahead of time because you need that stuff. But I would go ahead and have a bag that has your clothes, a baby outfit, if you want a cute baby outfit for pictures in the hospital, and your camera, and an extra battery for the camera. That stuff you will all want to have while you're in the hospital. Now, if your water breaks in the middle of the night and you don't have time to throw a bag together, they will have clothes for you and for the baby. And pretty much everybody's cell phone has a camera now. So even if you don't have your bag packed, you'll still be okay. But that would be helpful. And then baby classes. So classes like this where you learn how to take care of your newborn. There are classes for learning how to go through labor, Lamaze classes, things like that. Most of the hospitals that you're going to deliver at will have some sort of class like that too, where you can tour the hospital and learn about labor and things like that. Those are a good idea too, just so you kind of know your way around once you do get there. And breastfeeding classes, they have those both for expectant mothers and for after the baby comes, when obviously you can take the baby with you and kind of troubleshoot some of the problems that you're having. So those are helpful too. Again, most hospitals will have classes like that. There's Little HA League here in Omaha that offers classes too. Hospital tours, a lot of times that's part of your childbirth class. And then a prenatal visit is a good idea too. And again, you know, 4 to 6 weeks before your due date, you may want to meet with a potential pediatrician or a few and just get to know them. And almost every pediatrician in Omaha will do a free get-to-know-you visit where they just kind of explain the practice to you, how things work in the office, that kind of thing. There's plenty of lists you can get online to know what kind of questions to ask, but really I think it's getting a feel for the office, a feel for the doctor. Do you guys click? Do you see eye to eye on things like immunizations and things like that? Just getting a feel for their personality is probably the biggest part of that. Again, if you don't get that done, there will be someone who will see the baby in the hospital and you can decide later on, but that's just one less stress if you have that decided beforehand. What do you need before you get to the hospital to deliver the baby? You have to have a car seat. They won't let you take the baby home without one. So that's in bold because that's the most important thing that you need. It's helpful to have a stroller, a baby carrier, a baby Bjorn, or a Moby wrap or something to strap the baby to you because in those first few weeks especially, they like to be held quite a bit. And so if you have some way to carry them around, it's helpful. Diapers and wipes, you'll need not a ton of newborn diapers. If you end up with a 9 or 10 pound baby, you won't be able to use those newborn diapers. So have a few and then some size 1s too, because you'll go through all of those. And some wipes, and again, if you don't have any on hand before you deliver, they'll give you some at the hospital. Sleep sacks. I should just take blankets out of there and just put sleep sacks. You'll get plenty of cute receiving blankets at baby showers and things like that. But really sleep sacks are probably more helpful. They have the swaddle me ones that Velcro them in like a little mummy, and those are good for the little babies because they usually do like to be swaddled. If they're not swaddled, they tend to startle and their arms shake and that wakes them up, and that's pretty common. Some babies don't like to be swaddled. They will never settle if you've got them in that little mummy thing, but a lot of babies do because they're used to being pretty cramped up in your womb. So the sleep sacks, and then once they're a little bit older, the sleep sack that just zips down the front and has armholes is helpful, because then you don't have to worry about them getting their face caught in the blankets. Bassinet or crib, somewhere for them to sleep once they get home. And again, it doesn't have to be anything super fancy, but and actually they recommend, the AAP recommends that baby is actually in your room for the first few months of life, preferably in a bassinet or crib close to your bed. That's the safest place. The risk of SIDS is lower if they're in your room than in a room down the hall. And then breast pump and feeding supplies. If you're planning on breastfeeding, you want to have a pump, or at least know which one you're going to get before you deliver. You can always rent them from most of the hospitals as well. And then feeding supplies, so bottles, that kind of stuff you need to have on hand. And then when the baby comes, the first kind of few things that they'll do once the baby's delivered is first suction out the mouth and nose. They've got lots of amniotic fluid going on in there, so they try to get out as much of that as possible. Baby gets stimulated and dried off. They get their first grade at 1 minute and 5 minutes and sometimes 10 minutes of age. And that measures things like how well they're breathing, moving, what color they are, and how angry they are. And those scores don't really mean a whole lot. They're just a good quick way to give the nurse and the doctors in the room a quick view of how baby's transitioning to the outside world. They will apply an eye ointment. That's an antibiotic ointment that prevents any bacterial infections from getting transmitted to baby's eyes. Baby will get a vitamin K injection, and that's to prevent a really rare but sometimes fatal vitamin K deficiency that newborns can have. Generally, they get a hepatitis B vaccine that's recommended at birth. Even if you know you don't have hepatitis B, that's still recommended for every baby in the country. So they usually get that right away. And then finally, baby is swaddled and given to mom. That's kind of the general. Now, things don't always go exactly in that order. And if you would like baby to be placed on your belly or on your chest for skin-to-skin contact right away, let your nurse know, let your doctor know, and they will do their best to do that for you. Most hospitals are pretty good with that now. Now, if baby's not transitioning well and they're concerned about anything, then they're probably going to take them over to the warmer. But if you do want that skin-to-skin contact, let them know, and most of them are pretty good. As long as everything's going well, they're pretty good about doing that. In the first few hours and days, vital signs get carefully monitored, so temperature, respiratory rate, heart rate, things like that. They'll usually check a blood pressure and make sure that, again, baby's transitioning well to the outside world. If you're not doing skin to skin, they'll swaddle them up in several blankets, put on a hat. That's to maintain core temperature, because they're used to mom kind of providing them with that warmth. So it takes a little while to transition. And then you keep track of everything while you're in the hospital. Every poop, every pee, every feeding, how long, which side, all of that gets documented and written down. And the nurse will call the pediatrician. If you know who it's going to be, let them know. If you don't know yet, they'll call whoever's on call. And then usually they will come the next morning and see the baby and do that first exam, and then come see you every day while you're in the hospital. All right, I think we're going to talk about nursing a little bit here. So the American Academy of Pediatrics recommends breast milk for the first year of life. The World Health Organization recommends breast milk for the first 2 years of life. But again, they're looking at the whole world, not just the U.S. where we have good formulas and good clean water and things like that. But the first few days, you don't really have a whole lot of breast milk. You have colostrum, which is kind of a little bit different than breast milk. It's usually kind of thin and watery. It has more protein in it than fat, and it has a really, really high concentration of antibodies in it, which are really important for baby. So even if you're not completely sold on breastfeeding, you're not sure you want to or not, I would still recommend colostrum for that first few days. At least give them a few feedings, because even just getting a few days of those antibodies is really, really good for the baby. Benefits of breastfeeding: it's cheap, it's natural, it's easier. You don't have to tote quite as much stuff around with you. A nursing cover to cover yourself up if you're modest, and really that's about it. There are lots and lots of health benefits of breastfeeding. Babies who are breastfed have fewer ear infections in the first year of life, fewer colds in the first year of life, and then later on down the road they have decreased incidence of diabetes, obesity, and fewer food allergies. They also get IQ points from getting breast milk. The studies show anywhere from 2 to 10, but still, even if you can get them 2 IQ points, that's a good deal. Reasons to feed with formula: some women can't breastfeed. Some women may have had breast surgery or are not able to do it or don't want to do it. There are lots and lots of formulas out there that simulate many of the components of breast milk, so they have a lot of that good stuff in it. They've not been able to replicate the antibodies. There's no formula that's going to give your baby that immunity that breast milk can, but most of the other stuff is in there. So a lot of the formulas have added DHA and ARA, which are doxyhexanoic acid. I can't even pronounce it, but anyway, it's long chain fatty acids that are important for brain development. As the brain develops, it really needs fats, and specifically these long chain fats, to develop, and they do have those in there. Probiotics or prebiotics, those are two slightly different things, but they're both main goal is to promote a healthy gut, healthy bacteria in the intestinal tract. There are lots of hypoallergenic varieties of formula. So if you have a baby who can't tolerate breast milk or has allergies to certain proteins, things like that, formula is sometimes the way to go. And for some women, they just need to know how much they're giving their babies. I have met people who they can't stand not knowing exactly how many ounces and how they're getting each time. So sometimes formula is good for that too, because you can tell exactly how much they're getting. I threw in I got a book of quotes from my mother-in-law when I had my first kid, and so I threw a few of those in there. I don't know why they say you had a baby. The baby has you. So in that first day of life, bonding begins. So again, a lot of skin-to-skin contact, just holding, cuddling the baby, and just getting to know each other, basically. Baby's often sleepy in that first 24-hour period. They've gone through a lot. Labor and delivery is a tough for both mom and baby, so a lot of times they're kind of sleepy that first day. They wake up the second day, though, don't worry. And then it's important to try to latch every 2 to 3 hours if you're planning on nursing, especially. That will help stimulate your milk production and kind of teach baby how to latch. And learning to watch for your baby's signs of hunger. So you don't want to wait until they're screaming hysterically to try and feed baby. You want to look for those signs that come in that 5 to 10 minutes before that, when they start to just get kind of restless or start kind of turning their heads and rooting around a little bit. Babies have this reflex where if you stroke their cheek, they go and look for that boob. So you start to learn what signs to watch for. Again, in the second day of life, they wake up and usually they're hungry. And sometimes they're fussy because, again, that milk doesn't usually come in for about 3 days. So that second day when they're awake, they're hungry. They're a lot of times wanting to eat or wanting to latch on a lot because they're not getting a ton of volume. They're getting the colostrum. They're getting those good antibodies. And it's okay because they're born with some extra weight, so they can handle that couple day period of not getting a ton of milk. But they do sometimes let you know they're not very happy about it. So again, you'll see cluster feeding where they want to just eat for 1, 2, 3 hours in a row, and then they'll do kind of a longer period of sleep. And it's normal for all babies to lose weight up to 10% of what they weighed when they were born, and they usually gain that back by the time they're 2 weeks old. Other things that happen during your hospital stay: they'll do a newborn screen, which is a little heel poke that checks for diseases like cystic fibrosis and several metabolic diseases that you probably haven't heard of, but that are important for us to know in that first couple days of life if baby has. Again, we have results of that back usually by the 2-week visit. A hearing screen is done while they're asleep. It just lets us know that they can hear. They'll check the weight every day because they usually lose a little bit, and we want to make sure they don't lose too much. And then watching for jaundice. So lots of people will be asking you what color your baby is and checking to see what color your baby is. We'll talk about jaundice here in a minute. If you have a boy and you want him circumcised, that happens in the hospital before you go home. Either the obstetrician or the pediatrician will do that. They do use anesthesia, a little local injection to take away some of the pain, and then most doctors will use a little sugar water too to make it less painful for the baby. That usually heals over a week or so. It looks disgusting and ugly as it's healing up. It looks like a scab, but usually by the time they're a week old, it looks pretty good. And then that belly button, the umbilical cord falls off usually within the first 2 weeks too. You don't have to do anything to that. Unless it's starting to look red around the area, then you want to let your doctor know right away. But generally, it'll just fall off on its own. You don't have to wash it or put alcohol on it or anything. It'll take care of itself. But the circumcision and the umbilical cord are the reason we don't give babies tub baths for that first week or two, is just to let everything kind of heal up on its own. So we'll talk a little bit about jaundice. Jaundice is caused by increased bilirubin in the blood, and the bilirubin is there because the red blood cells start breaking down, and we all have red blood cells that break down all the time, and our liver is responsible for taking care of it. Well, babies' livers in that first couple of days don't work the greatest, and so as you see those broken down red blood cells, they look yellow. The baby can start to look yellow. So if we see that, we measure usually with a little light on the forehead. If we're worried that that's not accurate, then we do a little heel poke and get a blood level. That's the more accurate way to do it. It's normal to have some elevation, and we have a little curve that we look at to see exactly how many hours the baby is old and how high the level is. And if it gets too high, then we treat with Billy lights, which is like this little UV blue light blanket that we wrap around baby, and then recheck the bilirubin level the next day. We do this because if you get too high of a jaundice level, it can actually stain and damage the brain. We never see that anymore because we're so careful about checking for it. There's actually two types of jaundice. The more common one is in the first few days of life, and breastfed babies, because they're not taking in as much volume, can be more jaundiced than formula-fed babies. They're not peeing or pooping as much because they're not getting as much volume in, and so that usually peaks at day 4 or 5, and then it goes down on its own. Breast milk jaundice can happen in babies who are strictly breastfeeding at 6 to 12 weeks of age. They can still sometimes look a little bit yellow, and that's because there's an enzyme in the milk that decreases the excretion, how much gets pooped out. Again, not dangerous, just something we watch. So the milk comes in between day 3 and 5. Your milk will come in whether you're breastfeeding your baby or not. So be aware that if you're formula feeding around day 3 or 4, you're going to be sore because engorgement occurs, and all of a sudden breasts grow a size or 2 or 3, depending on how engorged you are, which changes the shape of your breast and can sometimes completely change the way that your baby's latching on. So that's always something we watch for too, because generally that's the day you go home from the hospital or the next day. And so we get a lot of phone calls in that first day or two saying that latch is more difficult or it's different. And it's usually because of engorgement. Pumping, using a breast pump, which again is a good reason to have one before you go to the hospital, can help with the pain from engorgement. You start to see baby gain weight again and act more satisfied after a feed. So instead of doing so much cluster feeding, wanting to eat for a couple hours at a time, they'll nurse for anywhere from 10 to 30 minutes and then be done and satisfied and asleep. So how do you know baby's getting enough? Until they're back up to birth weight, which is usually a week or two, you do have to wake your baby every 2 to 3 hours to feed them. You want to see about 4 wet diapers a day. You want to see in the first few days about as many stools as they are day of life. That can vary a little bit as long as they're going through that transition of the meconium stools, which are that black, tarry, disgusting, hard to get off the skin. That's the first day or two. And then as that gets released, then they turn into that green and finally to the yellow kind of seedy stools that we're used to seeing in babies. And sometimes they'll feed 40 to 45 minutes at first until milk is in. Then a lot of times it's closer to 20 minutes. Again, if you have a really, really efficient baby, maybe 10 minutes. Some babies are slower and it's closer to 30. You want to feed off both sides usually before milk comes in, and then once it's in, a lot of times you can just do one breast per feeding, and that allows baby to get hind milk, which is sort of the fattier part of the breast milk that comes at the end of the feeding. And it's helpful to have some way of tracking which breast you fed off of so that you can do the next one. You'd think you'd remember, but you're pretty sleep deprived. So having a bracelet on the wrist you just fed off of, or some way to mark which breast you fed off of last time is helpful. So laughter is like changing a baby's diaper. It doesn't permanently solve any problems, but makes things more acceptable for a little while. So we'll talk about what happens when you get home from the hospital. Things to watch for, the things we really need to know about right away would be if you ever get, if you're worried the baby feels warm, you have to do a rectal temperature. That's the only accurate way to get a temperature in a baby. The forehead ones are okay and the ear ones are okay for kind of a screening, but if you think it might be high, you got to do a rectal one. Because it's the most accurate, and if it's ever 100.4 or higher, then we need to know right away. Fevers in babies for the first month or two, we need to know about right away. 9-month-olds who get the 102 because they're in daycare, not such a big deal, but in that first month or two, it's a big deal. If baby's not waking on their own, or you can't wake them up for more than a couple feedings in a row, we need to know. If they look more yellow than they did when you left the hospital, we need to know. If they don't poop for 24 hours or they're not having at least 4 wet diapers a day, you need to talk with your doctor. Or if you ever see blood in the stool, obviously, we would want to know. So what are the important kind of take-home messages? You'll hear lots of this advice, especially from your mother and your mother-in-law. They'll give you all kinds of good advice when you get home. But sleep when the baby sleeps, and that's really hard to do, but it's really important because it's really hard to get good rest otherwise. So if it's 2 in the afternoon, even if you weren't previously a napper, at least try to lay down and close your eyes for a little bit, because you're not going to get as good of sleep at night. So forget about the laundry, let people help you with the house, let people help you bring you dinner, that kind of stuff. If somebody says, what can I do? Have an answer ready, whether that's, hey, I'd love if you could stop at Burger King on the way or whatever. We need some food around here. Let people help you because they want to. They're just not always sure how. And then drink plenty of fluids. Make sure you're eating because that's going to help your recovery, help baby grow, and keep you both happier. So we'll talk about some of the common concerns that come up kind of in the first few weeks and months. Spittiness. Over half of newborns will be spitty babies. As long as they are not angry spitty babies, that's okay. If you have a baby who spits up after every single time you feed them, but they're gaining weight, and they're generally not super fussy, that's okay, that's normal. And the reason is you have a little muscle at the top of your stomach, the bottom of your esophagus. And in adults, it's closed like a fist until you eat something, and then it opens and then it closes. Not everybody's. The pregnant women in the room know that right now some of theirs is not closed like a fist. It's open, and they're having reflux right now probably. But in babies, it's really floppy. It doesn't close all the way. They're always laying on their back, so it's really easy for food to come back into the esophagus, and that's very normal. But if they're not gaining weight, or if they are super fussy, that's something you want to talk to your doctor about. If you ever see a greenish colored, bile colored vomit, that's something you want to talk to your doctor about. Or if it's the kind of spitting up that used to just kind of roll out of their mouth and all of a sudden it's shooting across the room and hitting the wall behind you, that's something you want to talk with your doctor about too. So what do I do at 2 o'clock in the morning when I can't get this baby to calm down? Hungry. So has it been 2 hours, even an hour and a half since their last feeding. If they're going through a little cluster feeding spell, they might be hungry. Do they have a clean diaper? Did they just poop all over themselves? Do they need a cuddle or a bounce? Do they just want to be held for a while? Have they been spitting up constantly after every feeding and now they're getting fussy from it? Has he not pooped in a day or two? Or is it colic, the C word, and that usually peaks at 2 months. There's no good scientific reason for it. Some babies are just criers, and the definition of colic is a baby who cries greater than 3 hours a day, which if that's you with that crying baby for 3 hours in a row, you want to rip your hair out by the end of that. So what do you do? This is courtesy of Harvey Karp, who wrote a book, and these are his 5 S's. And there was a recent study published on these showing that these 5 S's, these techniques used in babies right after they're given shots, like within the minute after they're given shots, it decreased their pain from shots and it decreased their crying time. So there really is some scientific evidence behind this. So the 5 S's are swaddling. Again, those swaddle me's or those blankets that have the Velcro are nice for that. Side position. So some babies don't like to be flat on their back. They're not used to that. So they'll be a little calmer if they're on their sides. You can't put them to bed on their sides and then walk away. They still have to sleep on their backs if you're not sitting right there next to them. But if it's just nap time and you're right next to them, you can try a side position. Shushing, that's also any kind of like white noise machine, things like that. Babies really respond to that. There's some that kind of sound like a heartbeat that sort of simulates mom's heartbeat. A lot of babies like that. Swinging, pretty self-explanatory, and then sucking. So either a pacifier, bottle, nursing, whatever, any of those things stuck in the baby's mouth will a lot of times help with the fussiness. And then some more of the common concerns that we get, goopy eyes. So you have a little tear duct that goes from the very corner of your eye down towards your nose. That's why when you cry, your nose usually runs. In babies, and some babies, that duct is so small, it's virtually closed. And so instead of the tears draining down into the nose, they just kind of come out. And that's relatively normal. So we don't worry about that in babies until they're a year old. But some babies will always have that kind of goopy eye that seems like it drains all the time. As long as the white part of the eye is still white, it's not usually an infection. You can always ask your doctor if you're not sure, but a lot of times those goopy eyes, as long as the white part looks white, it's okay. They do generally grow out of that on their own. And then you can do, for the babies with the constantly goopy eyes, just a little massage where you just kind of massage right where that duct is with diaper changes, and sometimes that helps it open up. And then warm compresses just to help wipe that goop away. Fingernails, it's much easier to file them for the first few weeks. They kind of stick to the skin right after babies are born. So you can clip them. There's nothing wrong with that. You might cut the skin a little bit and they might bleed a little bit, and there's nothing wrong with that either. But it's easier to just get the little baby files or even a regular emery board and file them down for the first few weeks. They make those little, and some of the outfits even come with those little hand covers that kind of have elastic around the wrists. That can slow eye coordination, can slow hand development. So we generally don't recommend those. Now, if you have a baby who's clawing their eyes out and you want to put them on while they're sleeping, that's probably okay. But when they're awake, you don't want to have those on. Babies get hiccups all the time. Again, they have kind of an immature nervous system. The nerve that goes to the diaphragm is still forming. And so a lot of times they hiccup very frequently. And it almost always bothers the parents more than it bothers the baby. Funny breathing. They kind of do this almost like a panting. And then they pause. And they scare the heck out of their parents, and then they start breathing again. And that's pretty normal too, as long as it's not lasting 30 seconds, that's okay. And as long as they're not turning color, that's okay. White spots in the mouth is sometimes thrush and it's sometimes milk. If you can wipe it off, it's probably milk. If you can't, it's more likely to be thrush, and something that your doctor should take a peek at. Rashes, we could talk about rashes for hours in newborns, but just believe me when I say that there are many of them, and most of them are not a big deal. So again, you can always have your pediatrician take a look at them, but I wouldn't get too terribly excited about any rash that shows up on your baby. without talking to a doctor first. And then pooping. So in that first few days, you know, first they have the black stuff, then it transitions to the green and the yellow stuff. And then once they're in the yellow stuff, you think you're in the clear, you got it figured out. And then they'll go 2 days without pooping, or 3 or 7. And if you have a breastfed baby, a lot of times they do that because they're really, really good at using all the nutrients from breast milk. So there's just not a lot of waste left. And that's okay. And again, you can always call your pediatrician if you have questions about stuff, but rest assured you will have pooping questions, and you will talk about your baby's poop way more than you ever thought you would. So all of you eye rollers who have rolled your eyes at friends when they had their babies and talked about poop all the time, I bet you'll do it too. All right. So the most important things about preventing illness in your newborn: wash your hands. That's the number one thing. You touch a lot of stuff during the day, so you should be washing your hands before you touch your baby, and make your family members and friends who come to visit do that too. I would keep a hand sanitizer bottle in every bag you have, your diaper bag, your purse, all of that stuff, and don't be afraid. Don't feel bad about asking people to wash their hands or to hand sanitize before they touch your baby. In the first month, you really don't want your baby around anybody sick. So not like you have to quarantine yourself in your house, but you really don't want anybody who's sick or even has a cold handling them, because even colds can be a big deal in a baby who's under a month old. Again, if this is in there twice because it's important, if their temp's ever above 100.4, we need to know about it right away if it's in that first month or 2 of life. Talk a little bit about SIDS, which is sudden infant death syndrome, and the biggest risk factor is having stuff in the bed, and well, I don't know, that might be a tie. I shouldn't say that. It might be cigarette exposure. But those are both pretty big ones. So you don't want anybody ever smoking in your home or in your car. And you don't want your baby being held by someone who's just been smoking either, because those all increase the risk of SIDS and asthma and lots of other bad stuff too. As well as pillows, blankets, those cute little crib bumpers. They finally started making some sets of like crib bedding that doesn't have the bumpers in it. I'm so happy about that, but a lot of them still do. Find creative ways to use those somewhere else in your decor, or just throw them out, because they're just not safe to have in baby's crib. They make the breathable ones that go around the outside. Those are okay. There's no way baby could get the face stuck in those. But you really don't need them. If your baby sticks an arm or a leg outside of the crib, they're going to scream and you're going to come and fix it. So don't be worried that they're going to break limbs or anything by getting them stuck in the bed. Back to sleep. So you'll hear about this about 1 million times before you even leave the hospital. All babies need to sleep on their backs. That decreases the risk of SIDS. They've actually found that using a pacifier is beneficial, decreases risk of SIDS. If you're nursing and you're worried about nipple confusion, you can always wait a couple weeks or 4 weeks to introduce the pacifier, but it actually can be beneficial. And you don't want your baby to be overheated. So if you're comfortable in short sleeves, don't think that your baby needs 3 layers of clothes on. They're probably fine in a little sleeper and then the sleep sack or something like that. But you don't want them too hot. They also have shown that having a fan or some air moving in the room can be protective as well. All mothers are working mothers. Again, that was a quote from my book there. Breast milk storage, this is just kind of handy to keep with you. Room temp, breast milk's good for 10 hours. That's only if the baby has not drank out of that bottle. Once baby drinks out of the bottle, you pretty much need to get rid of it within an hour, because they backwash a little bit into it, and that mouth bacteria can breed in the bottle and cause trouble. But if they haven't drank out of it at all, it's good for up to 10 hours. In the fridge, you can leave it for about a week. In most freezers, you can leave it for 3 to 6 months. So same thing with formula bottles, by the way. Once they've drank out of it, an hour and it's done. You just need to toss it and start with a new one. And then you should never microwave breast milk or formula, because it causes hot spots. And especially with breast milk, it can break down the proteins and it's not as beneficial for the baby. So just use the boiling water, or even just run it under the hot tap in the first few weeks, they're not drinking that much. It only takes a minute to hold it under hot water and warm it up that way. All right. Remember, your doctor is a phone call away. That's a good question to ask if you go in for a prenatal visit with the doctor is, do they have an after-hours phone service? And most of them do. But that's a very helpful thing to have because questions always come up in the middle of the night. It's always after the office is closed. So it's helpful to have somebody on hand who's trained to answer your questions. The nurses in the clinic probably know more about common baby stuff than I do because a lot of them have been doing it longer than I have, and they can answer almost any question for you. And I guarantee you they've heard it before, so don't be embarrassed to call and ask. Lactation consultants at Children's, we're fortunate enough to have a lactation consultant who works with all of our physicians. So ask if you feel like you need help or if you have questions about something, ask because those people are available too. There's always somebody who can help answer your question. If you feel like you didn't get a good answer the first time, keep asking because in the end, what's best for your baby is what's the most important. So, all right, I think that's my son, probably about a year. So yeah. He's 3.5 now. I probably should update that slide, but yeah. So I think we'll go ahead and take questions. Yes.
When does the risk of SIDS go down?
By about 6 months, 4 to 6 months. So yeah, by the time they're 6 months, they're generally rolling both from front to back and back to front. They have pretty good neck strength, and the risk goes way down after that. That was another thing. Thanks for bringing that up. Once your baby's sometimes 4 months, sometimes 3 months, they'll start rolling on you, and sometimes it'll freak you out because you'll go get them from the crib and they'll be on their bellies. Once that starts to happen, they generally have enough neck strength to be able to get themselves out of a bad situation. So don't feel like you need to be checking on them every hour because they rolled over that one time and now you're afraid they're going to sleep on their bellies. A lot of babies do prefer to sleep on their bellies, and so once they can roll over, they will. And again, as long as there's no bumpers or blankets or anything they could get their head stuck in the crib, they're okay. Yeah.
What would, obviously besides calling 911, what would be the best to do if you think your baby has stopped breathing?
911, yeah, absolutely. If it seems like most babies who seem like they stop breathing, it's a choking thing. So being CPR certified is always a good idea too when you're bringing a baby home, but basically flipping them over onto their bellies and doing some pats on the back to help get anything that's in the airway out is probably the best thing to do in that situation. Sometimes they seem to like gag and choke a little bit on their feedings. And again, they can almost always clear it out on their own, but it scares the heck out of you sometimes. Anything else? You guys are a quiet bunch. Yeah.
Can you, is it okay to switch if you are breastfeeding, but is it okay to kind of switch to formula for emergency situations, or if you're not feeling like they're getting enough, is it okay to kind of do both?
Yeah, absolutely. I always say a little breast milk is better than none. So it's not an all or nothing thing. And a lot of women kind of get into that mindset of I'm a failure if I can't feed my baby from the breast every single time. Well, that's not true. If you're doing half and half, they're still going to get the immunity from that. They're going to get the benefit from that. So yes, absolutely. Don't feel like if you have to supplement. And sometimes your doctor will recommend that. If your baby loses a lot of weight right when they're born, sometimes your doctor will say, hey, we need to give this baby a little bit more food just for a few days, and then you can go back. And again, that doesn't mean you're a failure. That just means that your baby needed a little bit of food. So don't feel bad if that happens. Mm-hmm. Yep. In the first couple weeks, I would recommend trying to nurse as much as possible. If you don't nurse as much, you're not going to get as much milk, basically. But yeah, you can do it right from birth if you want to do a little bit of both, or have dad give a bottle a day or something like that. That's generally fine to do. Yeah.
Is there a recommended bottle type or brand?
Totally depends on the baby. So when you're registering for stuff, I wouldn't register for a whole case of anything because you don't know what your baby's going to do. If you have a super spitty baby, then you might need something like the Dr. Brown's or some of those fancy ones that have the anti-gas bubble magic to them. If you have a baby who's a laid back, easy baby with no feeding problems, you can go get the cheaper ones from Walmart or whatever, and they'll do just fine with them. So it's pretty baby dependent. There's not one best brand that I can recommend. I think all of them now have gotten rid of BPA. A couple years ago, that was a big deal. They found that some of the chemicals used in the plastic bottles was potentially carcinogenic. So they took that out, I think, of all the bottles now, but you want to double check the box and make sure it says BPA free on it. Yes.
Do you recommend drop-ins, or what's your theory on those?
Yeah, those work fine. Those are BPA free. Those are kind of nice, especially if you're going to nurse or pump and store some milk. There's some systems that work together so that you can just freeze it right in the bag that you're going to feed it from, and that can be pretty convenient sometimes. And those are pretty good about getting the air bubbles and stuff out too. If you're really environmentally conscious, you're going through a plastic bag every time, so some women don't like that aspect of it.
Till what month does the colic or gas problem is there in kids? Till how long?
Usually the colic will kind of peak around 2 months of age, and it usually goes away by 4 months of age. Some babies, especially if they have a component of reflux to it where they're kind of spitty, usually that starts to get better by about 6 months of age. So it can last a little bit beyond that 4 months, but usually by 6 months they've got things pretty well figured out. Yes.
Do you have any recommendations for prevention of like the flat head, or are there any long-term concerns for?
Oh yeah, I should put a slide about that in there. Thanks. So tummy time, we recommend starting pretty much right away. If you wait a couple months and then try to put them on their bellies, they hate it. Hate it. Though I don't know why. They like to sleep on their bellies, but if you try to do it while they're awake, which is when you should do tummy time, they hate it. So I would start it right away. 3 to 5 minutes at a time, 2 to 3 times a day. It's, there's no science behind that, but that helps build up neck strength a little bit. And then when you put them down, you can kind of vary which way you turn the head. Because at first, they're laying flat on their back, but generally the head's turned one way or the other. So kind of vary. And if it's easier to remember to put the whole body in the crib the other way as opposed to which way did I turn the head last time, just flip their whole body around. But that'll help prevent having one side that's flat. There are a lot more flat heads now. They almost always round out by themselves. And once they hit 6 months and start sitting up a little bit better, then it starts to round out, and usually by a year they look pretty good.
Right away, what do you mean, like 2 weeks, starting 2 weeks or something?
Yeah, when you get home from the hospital. And they're not going to lift up very much. They'll do more lifting. Like if you hold your newborn up here, you'll be surprised. They have a lot of neck strength. They'll try to look back and kind of hold their head up that way. But yeah, you want to just a few minutes on the floor. And even if they don't lift their head much at first, again, they're just getting used to it and getting used to being on their tummy so that when they do develop a little bit more strength, that they'll use that head a little bit better. Yeah.
I have a dog at home. What are your theories on introducing baby to dog?
Most animals will do fine. They always used to say, watch out for your cats. Most cats do fine too. I always recommend taking a blanket home or something that was at the hospital with you home so they can kind of get the smell of it first. But I forgot to do that. So, and my dog still did fine. So generally they can sense that how protective you're being of the baby. And so generally they will be protective too.
So it's okay to let them sniff right when they get home. Okay.
Yeah.
And that's the same with cats, right?
Yeah. Generally cats are fine. If you have cats that you're worried about, then I would either gate the baby's door or even close the baby's door to keep them out of the room. But again, most cats do fine too. Yeah.
Do you have any, tips or anything like that about kind of introducing to your toddler?
Yeah, toddlers, they'll fool you. because you'll have a toddler that you think is going to be terrible, and then they'll be great. They'll be super helpful. And then some of the most laid back toddlers will go through a little phase of hating the baby. And either way, you just kind of have to roll with what comes. But I would try to make it exciting. Get a baby, get a big brother or big sister gift for the other child when they come to visit in the hospital. That's always kind of nice too. Then they feel like they get a little bit of special attention, and try to kind of give the toddler at least a few minutes where dad can take the baby, mom can hang out with the toddler, something like that, so that they feel like they're not completely being replaced. And then have them help too, even if it's just, oh, can you get me a diaper? Thank you so much. That's so great. I love it that you're helping me with the baby, and that usually helps too.
And always a suggestion for the toddler, if you go for shopping anytime for the baby, make sure you get something for that kid.
I can backfire on you. And every time you go to the store, they're like, where's my stuff? I want my toy.
What is your suggestion on massage? Like, when do we start? Or
with baby massage, yeah, you can start anytime, and probably the easiest time to do it is after bath. Putting lotion on them and doing a little bit of massage, and it's just kind of a calming, relaxing thing. A lot of times that'll help calm them down for bed. You want to start getting a bedtime routine by the time they're about 4 months. They'll start remembering that you've got a routine in place. So for that first few months, don't worry too much about how you put them to bed, but by the time they're 4 months or so, you want to start with the putting them to bed drowsy but not totally asleep, helping them kind of learn how to calm themselves and get themselves to sleep too. That'll help prevent some of those sleep problems later on. I saw a hand back here.
Bathing, do you suggest every day, every other day?
Usually every other day. We're in a pretty dry climate, especially in the winter time, so bath every day is usually pretty hard on the skin, and they don't get all that dirty, so usually every other day is enough.
So initially, like when you're feeding the baby, will it tell you like I'm not hungry anymore? I mean, it's just gonna.
Most babies will. Most babies will kind of turn their heads or spit out the nipple, or and you kind of have to read your baby. Initially, they only drink, I don't know, up to an ounce. It's not a whole lot, but within that first few weeks, they're getting up to 2 to 4 ounces. If your baby spits up after every feeding, probably the easiest thing to do is try smaller feedings more frequently, because that's what happens if you overfeed. It comes back up, it comes back out at you. So if that's happening, if your baby's spitting every time, then they're probably getting too much. Yeah.
So for how long do you need to burp after every time they bottle feed, as long as you're bottle feeding, burp them? Or is there like, once they're 6 months, you don't need to burp?
Yeah, once they're sitting up, they generally don't burp as much, and you don't have to worry about it quite as much. And again, probably part of that is that sphincter is a little bit stronger, and they're not going to spit as much. Most babies, if they're not great burpers, they're more likely to be spitters. Not, it's not a 1-to-1 correlation or anything, but and sometimes you have to play around with what the best position is. Some babies will do better over your shoulder. Some will do better if you're laying them on your lap, belly down, and burping them that way. So, but yeah, and at first, when you've got a newborn, you want to burp after every 1 to 2 ounces. You don't want to even do a whole feeding, because then sometimes it all comes back up at you if you haven't burped them for the whole feeding. Yeah.
When do you introduce the baby to solid food?
Solid foods. If you are still breastfeeding by the time the baby's 4 or 5 months old, we usually recommend that you just continue breastfeeding. The AAP is not totally solid on that. They recommend exclusively breast milk for 6 months, and then starting solid foods and continuing to nurse until they're a year. Babies who are on formula already have already gotten introduced to some of the foreign proteins and things like that. So what I recommend in my practice is, if you're still breastfeeding at 4 months, wait till 6 months to start foods. If you've already started some formula with them, you can start solid foods anytime between 4 and 6 months. You don't have to ever start until 6 months.
Yeah. When you say solid foods, are you talking like
baby food, puree? Yeah.
So when would you start cereals?
Cereal, yeah, that's usually the first food. So that's between 4 and 6 months. Yeah, and usually you do cereal for a few days or a week, depending. If you try to feed a 4-month-old cereal and every bite comes back at you, they're probably not ready to eat yet. So I wouldn't start introducing new foods until they're doing pretty good with the cereal. Then you can start with veggies. You usually do one at a time for 3 or 4 days to make sure they don't have a reaction to it. There's no scientific reason to start with cereal. It's just kind of historically what we've always done. It's fairly easy for baby to digest, but there's not really a lot of nutrition in rice cereal. So if you'd rather start with a veggie, avocado, sweet potato, any of those are fine. Yeah.
Is that to use in conjunction with formula or
Yes.
breast milk? Yeah.
Yes, with formula breast
Like,
milk.
would you feed them 3 times a day your solid?
Usually you just start with once. Yeah, because they're still going to get all of their nutrition from the breast milk or formula. At first, in that kind of 4 to 6 month period, you're just doing it to get them used to eating. They're not getting a lot of nutrition from it. And then between 6 and 9 months, you add the second and third meal, and they'll kind of let you know. A lot of babies, by the time they're 6 months, every time year 4 it goes to your mouth, they go like this. I want that. So they'll usually tell you when they're ready to move to that next stage. Yes.
What about milk? At what age do you?
12 months you switch from breast milk or formula to whole milk. Or if you're still nursing and you're happy and still nursing, you don't have to start milk at that age, but you can start doing, adding in dairy products and stuff like that at a year. For that first 12 months, they need the extra vitamins and minerals and all that stuff that's in the breast milk or formula. By the time they're a year, then you can usually switch them to vitamin D.
Rectal thermometer you were mentioning, is that something we should buy before?
Most of the time you can take the one that they were using in the hospital. They can't reuse those on another baby, so they'll usually give them to you.
And how often should we check their temperature?
You don't ever need to unless you're worried about it. Or if, let's say, your baby in the hospital was having low temperatures, they might say you need to check it a couple times a day when you get home. But if you've got a totally healthy baby and there haven't been any temperature concerns, you only need to check if you think they feel really hot or really cold. Yeah.
What are some concerns with preterm babies?
Preterm babies, it depends on how preterm they are. Now, a lot of times even 36-week-old or 36-weekers can go straight to the nursery, go home with mom, have no problems. But it depends on how early. Preterm babies are more likely to have breathing problems, need oxygen after they're born, more likely to have feeding problems, not be able to take enough food orally, things like that. Those are probably the most common. If you're talking really preterm, then they can have eye problems and kidney problems and all that kind of stuff too. But yeah, it really depends on how early they are. But a lot of, 37-weekers. So that's usually, if baby comes 3 weeks before their due date, they generally do pretty well. Again, still a little bit of increased risk of breathing problems and eating problems are the most common, but they usually do pretty well. Yeah.
So if you're doing the breastfeeding, how do you know when to burp your kid before in the middle of it so they're not taking in too much?
Yeah, breastfed babies can usually feed off of one side, and you don't generally have to pull them off and burp them, unless they'll get kind of fidgety. And if your baby's fidgeting and not nursing well, then it's worth pulling them off, seeing if you can get a burp, and then latching them back on. But if you've got a breastfed baby who's feeding well and wants to eat for 20 minutes without stopping, that's totally fine. They don't get, as long as they've got a good seal on the breast, they're not getting much air in there, so. All right, well, I'll stick around a few more minutes if anybody has questions they want to come up and ask. Otherwise, thanks very much, and congratulations again. You guys have a good night. Healthy pregnancies. Some of you look close.